The aim of this video is to talk to you about the chemotherapy treatment that you're going to be receiving. We will explain what it is and the potential side effects that you may experience whilst you're having treatment. We will be sharing important information with you about the risks of the treatment and what you must do if you become unwell. This is general information about chemotherapy treatment, and you will be given specific information about your treatment when you have your pre-chemotherapy consultation with the nurse. When you are undergoing cancer treatment, you will be given a 24-hour helpline number, which is a contact for you 24 hours a day, 7 days a week. We will discuss with you in this video what should ring immediately about, but most queries can be dealt with during the usual working week 9 to 5 hours when more support is available. There will be hints and tips that we will give you to help with some of the side effects, but we always advise that you ring the helpline with any worsening side effects that you are unable to manage, or with any of the side effects that need immediate attention. These will be discussed as we go through this video. Many of the side effects of chemotherapy are common across the range of drugs that we give, which we'll be discussing in this video, but some of the treatments we administer have specific side effects. These will be discussed with you when you attend your pre-chemotherapy consultation with the nurse. This may be by telephone or face-to-face. This is also an opportunity for you to ask any questions that you may have after watching this video, so please write them down. We'll be listing quite a few symptoms that may occur during your chemotherapy, but this does not mean that you will necessarily experience them. But it is helpful to know what is normal and what you should be ringing the helpline about. So firstly, we need to explain what chemotherapy is. Chemotherapy is a term that we use to describe many drugs that are given to destroy cancer cells. We call these drugs cytotoxic as they disrupt the way cancer cells grow and divide. Unfortunately, chemotherapy is not able to specifically find cancer cells, meaning that they can affect healthy cells, which can cause symptoms and make you feel unwell. The healthy cells usually recover from damage caused by chemotherapy, but cancer cells often cannot recover and they eventually die, or this may not always be the case. Chemotherapy drugs are often given as a single drug or in combination with other drugs. Chemotherapy can be given through the vein as an intravenous infusion, an injection, or they can come in a tablet form. They are given in cycles, for instance, once every 3 weeks for 6 cycles. Having chemotherapy in cycles allows for a rest period in between for your healthy cells to recover and for your side effects, if you experience any, to improve. The type of drugs that you will have will depend on the type of cancer you have. Specific information about your chemotherapy that you will be receiving will be discussed when you attend for your pre-chemotherapy consultation with the nurse. There are many reasons why we give chemotherapy, and your oncology consultant will discuss the reason for your chemotherapy with you. Chemotherapy may be given as a main treatment for the cancer, to shrink a cancer before surgery or radiotherapy, or to reduce the risk of the cancer coming back after surgery or radiotherapy, to make radiotherapy work better, or to treat cancer that cannot be cured but hopefully be controlled. It can also be given to help with symptoms that the cancer may be causing, for instance, pain. Your oncology consultant will have discussed with you the reason for your chemotherapy. This can be discussed further in your pre-chemotherapy consultation if you have any further questions. However, if the nurse is not able to answer them, you may need to go back to clinic to see the doctor for further information or clarification. You may be asking what you can do before you come for your chemotherapy. It is always advisable, if you are able, to have a dental check. This is to ensure that your dental health is good prior to starting chemotherapy and to let the dentist know that you're about to undergo treatment. So, should you require any emergency dental treatment, your dentist is then fully aware of your situation and can liaise with us about how we can get you treated safely. We do not advise that you have routine dental treatment during your treatment. We also recommend that you purchase a thermometer from the supermarket or local chemist prior to treatment, so you're able to check your temperature at home. This will be discussed in more detail later in the video and at your pre-chemotherapy consultation. Please ensure that you eat as normal and drink plenty prior to coming for your treatment. We do provide tea, coffee and cold refreshments, as well as biscuits and also sandwiches at lunchtime, but it is really important that you are well hydrated, especially if your treatment is given through your veins, as this will help the nurse with inserting the needle. What to expect when you come in for treatment. When you arrive to have your treatment, please book in at the reception desk and take a seat. Car parking is concessionary and you will only have to pay £1 for each visit, so please speak to your nurse about how this can be applied. After arriving, a healthcare assistant will take you to your chair and take your observations and your height and weight. You will need to confirm your name and date of birth, and a wristband will be put on during the duration of your treatment. During your first appointment, the nurse looking after you will confirm your consent and address any concerns or questions you have before proceeding. The nurse will also ask you a few questions to assess your fitness prior to proceeding with the treatment. If you are well, the treatment will be administered to you. This is done each time you attend for chemotherapy. If you are having your treatment intravenously, a cannula, which is a small tube that's inserted using a needle, is placed into the back of your hand or your arm to deliver your treatment. This will be removed before you leave the department. Some patients' veins are not suitable for a cannula due to difficulty with inserting them into the vein, so the nurses may speak to you about having a PICC or Hickman line put in, which is a semi-permanent line that is put either in your arm or chest and stays in place until you have completed all your cycles of treatment. There are some chemotherapy treatments whereby you have to have a PICC or Hickman line inserted, and your doctor will have already discussed this with you. We can give you more information about this when you attend your pre-chemotherapy consultation. After your treatment is finished, you will usually be given some tablets to take home to help with side effects, which will be explained to you at your first treatment. You will also receive an appointment for the next cycle of treatment, and you should expect to receive an appointment for a review by a doctor. This will be prior to your next treatment and may be a clinic appointment or a review by telephone. Before each of your treatment appointments, you will need to have a blood test, which can be either done at your GP practice or your local hospital phlebotomy department. This will need to be done 24 to 48 hours prior to each treatment. This will be discussed further when you attend your pre-chemotherapy consultation with the nurse. We will now talk to you about the potential side effects of chemotherapy. The side effects that you may experience will depend on the chemotherapy drugs you are having. Different drugs can cause different effects. We will be discussing the most common effects that people experience when on chemotherapy, but it does not necessarily mean that you will experience them all. Some of the side effects are mild and easily treated, and your nurse will assess you every time you have treatment and ask you to describe any symptoms you may have had since your last treatment or are currently having. The earlier we know about side effects, the quicker we are able to manage them. It's important that you are honest about what you may be experiencing, as worsening symptoms may result in your treatment needing to be delayed, which can occasionally happen to ensure that we are keeping you safe and well. Firstly, we will talk about side effects that you may experience whilst having the treatment on the unit. One of the risks when you receive any drug is the potential to have an allergic reaction. We will have established prior to your treatment if you have any allergies and what those are. If you have any allergies, you will have a red wristband instead of the standard white band. There may be a small risk that you react to the chemotherapy. If this happens, you will usually experience some immediate effects. Some symptoms of a reaction include a rash, suddenly feeling unwell, flushed, shivery, or short of breath. If you feel any different to how you did prior to your treatment or experience any of those symptoms, let your nurse know immediately. The nurses are experienced in spotting and dealing with reactions and will give you treatment to reverse the reaction quickly. Your treatment will be stopped until it is safe to restart your therapy, depending on your reaction. Another side effect that you may experience is aching or tingling along the vein when having the treatment. Please let your nurse know if you experience this, and they will assess the vein to ensure it is okay. If so, the nurse may apply some heat to your arm to help or slow the treatment down. Very occasionally, the treatment can leak out of the vein into the surrounding tissue. It is not a common occurrence, but if this happens, it is important to treat it quickly. Tell your nurse straight away if you have any stinging, pain, redness, or swelling around the vein. Some of the chemotherapy given can be harmful to the skin and require additional treatments if they leak into the surrounding tissue. You will be informed at your pre-chemotherapy consultation if you are being given these drugs and their individual risks.
We will now talk about side effects that you may experience after you leave the chemotherapy unit and thereafter. The side effect that the health professionals are most concerned with are how the chemotherapy can affect your blood cells. As mentioned earlier, chemotherapy can affect healthy cells in your body as well as cancer cells. The most important cells we have in our body are our blood cells. We have red blood cells that carry oxygen around the body, clotting cells called platelets that stop us from continuously bleeding, and white blood cells which help to fight infection. Potentially, chemotherapy can affect any or all of these cells. Due to the treatment, your red cells' ability to carry oxygen around the body is reduced, and you will experience some symptoms such as fatigue, shortness of breath, a rapid heartbeat, and feeling lightheaded. Your family may also notice that you look pale. This does not normally happen suddenly, but there can be a gradual drop over many months whilst you are on treatment. If you are experiencing any of these symptoms whilst you're at home, please call the helpline number, which will be given to you when you have your pre-chemotherapy consultation. A blood test will usually be arranged, and if necessary, a blood transfusion can be offered to help you feel better. If the chemotherapy affects your clotting cells, you may notice signs of bleeding or excessive bruising. This could be on the skin or bleeding in your mouth, from your nose, or when you cough. You may also notice bleeding in your urine and stools. This can happen at any time during the treatment, so please call the helpline immediately if you notice any of these symptoms. If the chemotherapy affects your white blood cells, you are more likely to get an infection. Often, the white cells can drop between 7 and 14 days after chemotherapy. They will then normally increase steadily and usually return to normal before your next chemotherapy is due. You may experience side effects when your white cells are low and you are more risk of picking up an infection. In order to monitor how you are and to see if you've potentially picked up an infection, we ask that you take your temperature every day. You can obtain a thermometer from your local chemist or supermarket, and the nurse can give you more details when you speak to them. By taking your temperature daily, it will become part of your routine and you will see what your normal temperature ranges are. We ask that you do it roughly the same time every day, as your temperature can often be higher at different times of the day. We consider a normal temperature to be between 36 and 37 degrees Celsius, but sometimes it can be slightly lower or slightly higher for different people. If you do your temperature every day, you will be able to judge what is normal for you. As well as the daily temperature check, we ask you to also take your temperature if you are feeling unwell, so we can pick up if there is a potential infection. If your temperature is between 37.5 and 37.9, we ask you to ring the chemotherapy helpline immediately for some advice. They will assess you over the phone and potentially ask you to attend one of the hospitals for a blood test and thorough assessment. However, if your temperature is 38 degrees or above, this indicates that you have an infection going on somewhere. So we ask that you contact the helpline immediately and they will assess and advise you where you will need to attend, so you can receive some intravenous antibiotics, have some blood tests and be assessed. If you have a problem contacting the helpline, then attend your local A&E department to prevent a delay. You will be given a blue antibiotic prescription when you attend the hospital for your treatment, which you should keep with you at all times. So if you need to come to A&E, you will be able to give it to the staff and they can administer the antibiotics without any delay. It is important to keep this blue prescription safe and easily accessible, along with your chemotherapy records. If the prescription has been used by the healthcare professionals, please ensure that you get another one when you next visit the chemotherapy unit. There are other symptoms that can indicate an infection other than a temperature. So if you experience flu-like symptoms, a chesty cough, feel shivery or shaky, or it is painful when you pass urine, you must call the helpline immediately for advice. It is important to know that if you have an infection and your white blood cells are reduced, you may not be able to fight the infection and this could potentially be life-threatening. So it is important that you act immediately if you have a high temperature. If you are having a drug that we know particularly affects the white blood cells, you may be given injections to take home, which are injected just under the skin to make more white blood cells grow and prevent them from dropping to low levels. Your nurse will let you know if you need to have them, as they are only prescribed with certain treatments. We have explained how chemotherapy affects the blood cells and your risk of infections, which is the part we as health professionals worry about the most. But we also want to tell you about the other side effects that you may experience whilst having treatment. And we will also give you tips about how you can manage them and at what point you should seek help. Chemotherapy can make you feel sick, and certain drugs can cause more sickness than others. If your chemotherapy has the potential to cause any sickness, you will be given anti-sickness medication when you receive your treatment, and also anti-sickness medication to go home with. Some of these tablets are given to prevent sickness, and you are expected to take them regardless of whether you feel sick or not. This is usually for the first few days after chemotherapy. You will also have backup tablets that you can take at any time you feel sick. If, despite taking these as instructed, you are still feeling nauseated or being sick, then contact the helpline and we can change your medication for you. We do not want people sat at home suffering with nausea or vomiting, as there are other drugs that we can use that are very effective. Some people experience a sore mouth or ulcers when they have chemotherapy. Evidence has shown that saltwater mouthwashes are the best way to manage this. Put a teaspoon of salt into a glass of warm water, rinse and gargle in the mouth and spit out. Do this 4 times a day if your mouth becomes sore. This will help with healing and prevent infection. If your mouth becomes worse, does not improve, or you are having trouble eating or drinking, then call the helpline, as there are mouthwashes and gels that we can prescribe for you. We would also suggest that you use a soft toothbrush, as a hard one can be abrasive and cause trauma in the mouth. You may get an infection in your mouth called thrush, which causes white spots or areas on your mouth or tongue. You can be given tablets or drops that can help with this. Often people can also experience loss of appetite when they are undergoing chemo. Part of the anti-sickness medication that we give you is a steroid, which can stimulate your appetite for a few days, but when this stops, you may go off food for a little while. Certain foods and smells can be off-putting, but you may also crave certain foods. Go with it and eat what you fancy, as you are more likely to have the things that you enjoy. But please be mindful of the food groups that you are missing out on, especially fruit, vegetables and protein. Eat little and often, as larger meals can be off-putting. If you are struggling to eat, try and increase your calorie intake to avoid losing weight. Converting to full-fat milk or having a biscuit or small piece of cake in between your meals with your cup of tea or a little pot of custard or rice pudding can help to increase your calories. If you are struggling with your dietary intake or you are losing weight, please let us know, as we can refer you to the dietitian for further advice. We will monitor your weight throughout treatment. Other dietary advice that we give to patients having chemotherapy is to ensure that all your food is cooked or washed thoroughly. and only use trusted restaurants and takeaways, as you will need to minimise your risk of getting food poisoning. It's also best to avoid soft cheeses and raw meat and raw fish. Taste changes can happen post-chemotherapy, and you may experience a metallic taste in your mouth. Hence, some people go off tea, coffee and alcohol too. Sucking mints, sweets or chewing gum may help with this. Please try and ensure that you drink plenty of fluids when having chemotherapy, as this can help with certain symptoms. If you fancy some alcohol whilst you're on chemotherapy, this should not be a problem if it is a small amount, and can often help sometimes to stimulate your appetite. But please check with the nurse or doctor first. Some people suffer with heartburn or indigestion whilst having chemotherapy. You can use over-the-counter medications to relieve this, but if it is persistent, let the doctor or nurse know, as this can be controlled with a daily tablet. Some chemotherapy drugs and anti-sickness medication can cause constipation. If you experience this, increase your fluid intake as well as the fruit and fibre you eat, as this will help. You can get over-the-counter medications which will help, but if you are still struggling, contact the helpline and something can be prescribed for you. Don't let constipation go on for too long, as this can cause pain, nausea and vomiting. Some chemotherapy drugs can cause diarrhoea, and we will let you know if you are taking a drug that is more likely to cause this. The main cause for concern if you experience diarrhoea is dehydration, so ensure that you drink plenty of fluids. If your treatment is likely to cause diarrhoea, we will give you some anti-diarrheal tablets prior to your treatment, and also give instructions on how to take them and when to call the helpline. Otherwise, if you experience diarrhoea that does not settle after 3 to 4 episodes, then you should call the helpline for advice. If you feel unwell or have a temperature, you may have an infection, so it's important to let us know as soon as possible.
Hair loss or thinning can be caused by some chemotherapy drugs. Your nurse will let you know if your chemotherapy will cause hair loss. We are able to offer scalp cooling for some of the treatments we give, and this will be explained to you when you attend your pre-chemo consultation. Scalp cooling is used to lower the temperature of your scalp to reduce the concentration of chemotherapy in the hope of reducing hair loss. Scalp cooling can have varying success, and your nurse can discuss this with you and the advantages and disadvantages of the treatment. It will add time onto your visit to the chemotherapy unit, as the scalp cooling machine will need to be started at least 30 minutes before your treatment and between 20 and 90 minutes after your treatment. There are some treatments, unfortunately, that we are not able to offer scalp cooling, and this will be discussed with you. If your treatment does cause hair loss, we can provide a £100 voucher to go towards a wig. There are a number of wig providers, and this will be given to you when you attend your pre-chemo consultation. Hair loss normally occurs 2 to 3 weeks after your treatment, and often people can become distressed when it is coming out, so many people decide to shave it. The hair follicles will initially be inflamed and the scalp can become tender, but you can use a cream like E45 which may help, but it will settle after a short space of time. Most people experience fatigue or tiredness at some point during their treatment. And this is fairly common, and it will get worse as the treatment goes on. Rest when you need to, but also it is important to maintain some gentle exercise. You can do the things that you normally enjoy doing as long as you feel up to it, but don't force yourself if you are feeling particularly tired. If you are resting for short periods in the day or needing a daily nap, this is okay. But if you are in bed all day, every day, because you feel that you physically cannot get out of bed, then please call the helpline number. For some advice, as this may be a cause for concern. If your cancer itself is causing tiredness and fatigue, you may find ultimately that your energy levels improve overall. There are some chemotherapy drugs that we give which can cause tingling or numbness in the fingers or toes. Some people describe it as pins and needles. This is called neuropathy, and it's caused because the chemotherapy affects the nerves in these areas. This is sometimes can affect you doing up buttons or completing fiddly tasks. Usually this gets better with time after your treatment has finished, but it can be permanent. Your nurse will ask you each time you come for chemotherapy if you have experienced this. And it is important that you tell them if you do, as your treatment can be tailored. Skin and nails can be affected by your treatment too. Your skin may become dry, slightly discoloured, which can give you a tan-like appearance, and you're more likely to become sensitive to direct sunlight. So please ensure that you cover up and use a high-factor sun cream. For dry skin, it is advisable to use a non-perfume cream, such as E45. Your nails may become dry, brittle or discoloured. Keep your hands moisturised, as this will help. Once your treatment has finished, these changes will take a few months to resolve. If your skin is becoming particularly sensitive or you have developed rashes, please call the helpline number for some advice, but you may need to avoid perfumed products. The side effects that we have discussed in this video are the more common side effects that people experience when having treatment. But this is not complete, as some people experience side effects that are less common. Some treatments have specific side effects that are associated particularly with that drug, and your nurse will go through these with you when you attend your pre-chemo consultation. We will now discuss other important information that you need to know when having chemotherapy. Some cancer drugs can affect your ability to get pregnant or to make someone pregnant, and in women, some treatments can bring on early menopause. If you are concerned about fertility, please discuss this with the nurse or doctor, but this should have been already discussed with you. You should not breastfeed whilst you are on chemotherapy, as the drugs may be passed on to the baby through the breast milk. When you have received your treatment, the chemotherapy can come out in your bodily secretions up to 7 days after receiving treatment. So if you or family members are handling bodily fluids such as urine or sick after you have received chemotherapy, we advise that gloves are worn. Any sheets or clothing contaminated should be washed on its own a couple of times on the highest setting. We advise flushing twice when going to the toilet up to 7 days after chemotherapy, and sitting down for men whilst passing urine may avoid splashing. You should not get pregnant or get someone pregnant whilst you are on treatment, as this can be very harmful to the development of the baby. So contraception must be used for women of childbearing age, which can be provided by the GP. As chemotherapy can be present in bodily secretions, we also advise using a barrier method, such as a condom, for the first 7 days after chemotherapy, if you are sexually active, to reduce the risk to your partner. Good hand hygiene is strongly advised when having treatment, so wash your hands often, especially before eating. Wear gloves if you are gardening to minimise any risk. Over-the-counter alcohol hand gels are a good item to have in your bag if you are out and about. When you have a cancer, you are at risk of developing a blood clot, and chemotherapy can slightly increase this risk. Blood clots can usually occur in the arms, legs or chest. If you're experiencing any pain or swelling in any of your limbs, or become short of breath or experience chest pain, please ring the helpline number immediately and you will be assessed. If a clot is suspected, a scan will be organised, and if it is shown that you have a clot, you will be started on daily injections. This should not affect you having your chemotherapy treatment. If you are starting chemotherapy during the flu season, which is autumn to winter months, we do recommend that you have the flu vaccination. It should ideally be administered before your treatment starts. In cases where this is not possible, the vaccination should be carried out within 2 to 3 days before starting the cycle of chemotherapy, as we would expect a better response if it is done at this time, rather than in the middle of your cycle. Please discuss this with the chemotherapy team before booking your appointment for the flu vaccination. During this video, we have briefly discussed the various common side effects of chemotherapy. We hope this has been useful for you and your family and carers. When you attend your pre-chemotherapy consultation, specific information about your treatment will be explained in more detail. Please make a list of any questions that you may have, and time will be given for the nurses to go through these with you. Thank you for your time, and we look forward to supporting you during your treatment.